This is a 14-year-old boy came with the complaint of pain epigastrium with no lab or relevant investigative procedures provided. So I placed the probe under the subcostal region. Here I see, and these structures. There is left lobe of the liver. This is the left lobe of the liver. This is the gallbladder. And now I am going to sweep the probe down up to the lower or lumbar region, subcostal area, in this fashion, to see if liver tissue is seen below costal margin or not. So now I am going to do it from epigastric region. I am coming down, keeping the probe straight. This is the lumbar region, the lower. Now I am giving this sweep. I can see a part of the liver. This is the kidney in transverse section, and this is the liver that is anterior to the kidney, that is visualized below the costal margin. I am here. I am under the costal margin and can see the liver tissue. So liver is seen below costal margin. Next step will be to see whether it exceeds the lower pole of the right kidney or not. I am scanning under the costal region and asking the patient, now under the costal region, maneuvering the probe a bit downwards, angling the probe a bit downwards. This is the subcostal area. I am angling it a bit downwards. I will ask the patient to take the deep breath and hold it. Beta lamba sa le ke saro karo. Sa khicho. Here we are. बस ठीक है, बाहर निकाल दो. So if you concentrate in this view, this is the lower pole of the kidney, this is the liver angle which is sharp, so that with sharp liver angle, the liver is almost at the level of the lower pole of the right kidney, it is not exceeding it, and this is the liver parenchyma. So the liver angle is sharp, the outer surface of the liver is smooth. This is the outer surface of the liver, which is smooth. Let's compare the parenchymal lipogenicity of the liver with that of the right kidney. It's almost equal to that of the cortex, which is with a normal. This is the liver parenchyma, and this is the cortex. These cystic areas that you are seeing are the pyramids in the medulla. They are seen above the pyramids, and below the capsule of the kidney is the cortex. So you see the echo brightness of the liver is slightly more as compared to the renal cortex. So this is also within normal. Now let's see what is the status of the intrahepatic veins. Now here two vessels are seen. This is the right, this is the left. This is the middle hepatic vein entering the IVC in transverse section. This is IVC in transverse section. This is the left hepatic vein entering the IVC. Along with it, see the parenchymal echogenicity. This is the diaphragm. What is the status of the portal veins? This is the extrahepatic portion of the portal vein. This is the extrahepatic portion of the portal vein. And this tiny cystic area with echogenic border is the hepatic artery in transverse section, and this longitudinal tiny vessel-like structure is common bile duct. This is the area of porta hepatis that contains one vein, one artery, and one duct. This is the area of the porta hepatis. Let's follow the portal vein in its intrahepatic course. Here you see it's dividing. This is the posterior branch, and this is the right branch. And so this picture shows us the division into posterior branch, anterior branch. This is the portal vein. This is the IVC. Parenchymal echogenicity is normal and homogeneous. There is no porcine seen. Let's see the probe of the liver. Placing the probe longitudinally, patient supine in the epigastric region. See the liver angle is sharp. Angle the probe towards the patient's right side. So that you can see the three structures most important. The left lobe of the liver is seen. Along with it, you can see the IVC in longitudinal section, and here you can see the caudate lobe of the liver. This is the left lobe of the liver. This is the ligamentum venosum. This is inferior vena cava, and in between is the caudate lobe of the liver. This is part of the portal vein, and this is the hepatic artery. Left hepatic vein entering the IVC. The echogenicity is normal and homogeneous. Let's see transverse section. This will be my angle. We have already studied this repeatedly, and here we see the branches from the ascending portion of the right of the left portal vein. Now this is the left lobe of the liver in transverse section, having smooth outer surface, homogeneous texture, normal echogenicity. This is the ascending portion of the right portal vein, and this is the left anterior horizontal branch. This is the left posterior horizontal branch. concentrate on this bright structure, this one. Concentrate on this area. This is in fact a triangular area, it is giving posterior shadowing. Now when I rotate the probe 180 degree, it becomes a longitudinal structure. This is ligamentum teres. This one. This is ligamentum teres. Concentrate on the same area. Again transverse. In transverse section. Here we are. This is structure. Giving you posterior shadow. This is ligamentum teres in transverse section, that bright shiny area that you are seeing, and it turns to a linear structure when the probe is given a full sweep in the same area. Now again, keeping it in view, try to again rotate it. Now let's see the vessels, the hepatic veins. All the three hepatic veins are visualized. They have sharp borders. See, they have very sharp borders. Right hepatic vein, middle hepatic vein, left hepatic vein. This is the ascending portion of the left portal vein. So far the study is okay, it's fine. This is the gallbladder, the spear-shaped area with its landmark at right angles to its neck, which is the portal vein. We have already discussed that this is the anterior wall of the gallbladder, this is the fundus of the gallbladder, this is the neck of the gallbladder, and it's clear internally. This is the portal vein, and it's at right angles to the neck of the GV. So you are not seeing any cystic area or any other abnormality, rather this is the gallbladder. And note the homogeneous equilibrity of the liver, no prominence of the portal veins, radicals, smooth outer surface. Now keeping the probe in the epigastric region and maneuvering it a little bit, I wish to get the splenic vein. This is the splenic vein. This is the aorta. This is the superior mesenteric vein, and this is the splenic vein, and a band of tissue anteriorly is the pancreas. This is the pancreas. This is the body of the pancreas. And this is the tail of the pancreas. This area. This band of tissue anterior to the splenic vein is the body of the pancreas, and this is the tail of the pancreas. Splenic vein is running posterior to it. So this is the pancreas. This is the portal vein. This is the superior mesenteric vein. Now longitudinal section. longitudinal section. This is the aorta, and this is the superior mesenteric artery. Superior mesenteric artery arising from it. This is the celiac trunk, and this is the left half of the liver. See its homogeneity, its eco-brightness, and smooth outer surface. So far, we are seeing a normal patient. This is the inferior vena cava, and when I move the probe towards the left side, this is the manual vein. This is the manual vein, and towards the right, I get the IVC. Towards the left, I get the aorta. Now let's compare the echogenicity of the pancreas with that of the liver. So this is the liver, and this is the pancreas. This is the liver, this is the diaphragm, this is the hepatic vein, this is the pancreas, this is the splenic vein, this is superior mesenteric vein, this is the aorta, this is the gallbladder. Now see the echogenicity. It's almost equal to that of the echogenicity of the liver. So the echogenicity of the liver equals the echogenicity of the pancreas. The reason being, the patient is 14 years of age, and the echogenicity of the pancreas varies with age. As the age advances, it becomes more echogenic compared to the echogenicity of the liver. This is the pancreas, and this is the liver. Placing the probe in the intercostal space at the mid-axillary line, and then moving the probe in line with the intercostal space, we get spleen. This is the spleen. This is the spleen. And this is the liver. Salapita, Sakicho, Proclo. Now compare the echogenicity of the two. The echogenicity of the liver and the echogenicity. This is the spleen. This is the spleen. This is the liver. This is the liver. This is the diaphragm. And this is the left hemidiaphragm. This is the splenic vein entering the hilum of the spleen. Compare the echogenicity of the two by yourself. Compare the echogenicity of the spleen with that of the liver. There is no fluid above the diaphragm in both right and left side. Place the probe in the suprapubic region transversely, and here is the urinary bladder. It's internally clear. This is the urinary bladder. That was the supreme urinary bladder. एक लंबा सा बेटा रोक लो. So this is a quick review. बस ठीक है बेटा. You see, the portal veins are recognized by their echogenic borders. Their borders are echogenic, and these veins, hepatic veins, do not have echogenic borders. Okay. This is the portal vein dividing into posterior branch, and then in the anterior segment, anterior part, you see the portal vein dividing into anterior. This is the anterior branch. This is the posterior branch. असल में कल्याण करना पड़ता है, फिर टाइम ज़्यादा लगता है, तो ये नहीं करना. These are both right and left portal veins seen together. This is the right portal vein, this is the left portal vein, and you see if this is the branch of this is the right portal vein, left portal vein, inferior vena cava, and the echogenic borders around the left portal vein are clearly seen, but this right portal vein does not show any significant amount of periportal echoes. The reason is that in this case the sound beam is traveling parallel to the right portal vein, and now when the beam strikes parallel to this structure, the echoes are not returned back to the transducer, and the reason that you don't see echoes in its anterior border. Here the echogenic border is seen around the left portal vein because the beam is striking this area parallel to the anterior surface of this vessel. So that is the reason the echogenicity that is being seen. The waves are being transferred to the transducer when you are scanning perpendicular to a particular organ or vessel, and in this case the beam is striking parallel to this area and passing straight, not returning back, and you don't see any periportal echoes. So this is an exception which you may come across that may confuse you, that whether this is a hepatic vein or a portal vein. This is a portal vein. Now why it is not giving you periportal echoes? The reason I have informed you. This small structure line here, this small linear structure is median lobar fissure, which is a landmark for the identification of the gallbladder. This small cystic area you are seeing is the neck of the gallbladder. So this is the interlobar fissure or median lobar fissure. Rest. Again you will see the outer surface is smooth, echogenicity is normal, there is no coarseness, there is no focal lesion. This is inferior vena cava in transverse section. These are minor portal vein radicals, these white structures. In kids, you may see them and it is not pathological. Now what is this line? This linear structure that is attaching with the left portal vein. This is the ligamentum venosum. This is the IVC, and this portion is the caudate lobe of liver. This is the transverse section of the left lobe of the liver. So when you scan the liver, left lobe of liver in transverse section, you will see the ligamentum venosum, and you will see transverse section of the IVC, and in between the area will be the caudate lobe of liver in transverse section. This is the left portal vein, right portal vein, main lobar fissure or interlobar fissure, gallbladder. One peak. Very good there. So though the patient came with the history of pain epigastrium, the ultrasound is normal by all parameters. This video segment is for the orientation of two linear structures that are seen when you are scanning in transverse section, especially the left lobe of the liver. One is this one. This is the lining structure, and second this one. Two linear structures in one plane. In one scanning plane, we are seeing two linear structures. Now, if you note from this linear structure, there is shadowing, posterior shadowing, this black area. There is no shadowing from this linear structure. This is main lobar fissure because it attaches to the neck of the gallbladder. This is the neck of the gallbladder. This is the main lobar fissure or the